Stop dog diarrhea. If your dog just had diarrhea all over your kitchen floor, maybe for the second or third time today, and you typed "stop dog diarrhea" into YouTube looking for a vet-approved home fix, you're in the right place. But here's what I need you to hear before we go any further. Most of what people do at home to stop diarrhea in dogs doesn't just fail. It actually makes the next round worse. And the reason is simple. They're treating the wrong part of the problem. See, the diarrhea itself isn't the disease. It's your dog's gut doing exactly what it's supposed to do when something goes wrong inside. It's a flush, a reset attempt, and when you shut that down the wrong way, or feed the wrong thing at the wrong time, you interrupt the reset and drag the whole episode out longer. I've watched owners do everything right according to the internet and still end up in my exam room 3 days later with a dog that's worse, not better. So today I'm going to walk you through what actually works at home, step by step, the same approach I use with my own dogs and recommend to my clients when the situation fits. But, and this matters, I'm also going to show you the exact warning signs that mean home care is not enough. Because there's a line, and if you miss it, you're gambling with your dog's safety. Let's start with the part almost everyone gets wrong. Why your dog has diarrhea. Right now, the first question every owner asks me is what caused this? And I get it. You want to know so you can fix it. But here's the thing. In most cases of sudden diarrhea in an otherwise healthy adult dog, you will never pin down the exact cause. And that's actually okay. Veterinary gastroenterologists, the gut specialists, will tell you that the majority of acute diarrhea cases in dogs are self-limiting. That means the body handles it on its own, usually within a few days, as long as you don't get in the way. The most common triggers: dietary indiscretion, which is the polite veterinary term for your dog ate something disgusting. Garbage, a stick, cat poop, half a sandwich off the counter. Stress is another big one. A new person in the house, a thunderstorm, boarding, a car ride, sudden food changes, switching brands without a transition period. Minor bacterial shifts in the gut. These are everyday causes, and they don't require a prescription. They require the right support at home. But, and don't skip past this, there are causes that look exactly the same on the outside but are genuinely dangerous on the inside. Parvovirus in unvaccinated dogs. Pancreatitis, intestinal obstruction from something your dog swallowed. Hemorrhagic gastroenteritis, toxin exposure. These can kill a dog, and they often start with plain old diarrhea that looks no different from the garbage rate kind. So the home fix I'm about to give you only applies if your dog passes the safety check. We'll get to that safety check in a minute, and I need you to take it seriously because everything I teach you after that point is useless, maybe even harmful, if your dog actually needs a vet right now. Well, let's talk about what to do. The 24-hour reset step 1 is not a special food. It's not a supplement. It's rest for the gut, and I mean real rest. For a healthy adult dog with sudden diarrhea and no other alarming symptoms, we'll define alarming shortly, I promise. The first move is a short fasting period, 12 to 24 hours with no food. Water stays available the whole time. You never withhold water from a dog with diarrhea, but food stops. Now, I know that feels wrong. Your dog looks at you with those eyes. You feel guilty. But think about what's happening inside. The lining of the gut is irritated, inflamed. Every time food passes through, it triggers more contractions, more fluid secretion, more diarrhea. By pulling food for half a day to a full day, you're giving that lining a chance to calm down and start repairing itself. This isn't starvation. This is a reset. Veterinary teaching hospitals, places like the ones at UC Davis, Cornell, Ohio State, have recommended this approach for decades for uncomplicated acute diarrhea in adult dogs. One critical exception: do not fast a puppy under 6 months old, a toy breed, a senior dog with other health conditions, or any dog that's already weak or lethargic. Small dogs and young dogs don't have the energy reserves to go without food safely. If your dog falls into any of those categories, skip the fast and go straight to the bland diet, which I'm about to cover. Or better yet, call your vet. During the fast, you want to make sure your dog keeps drinking. Diarrhea pulls fluid out of the body fast. Dehydration is actually the most immediate danger of diarrhea, not the diarrhea itself. If your dog won't drink plain water, you can offer low-sodium chicken broth. And I mean low sodium. Check the label. No onion, no garlic, no added seasonings. Just plain broth. Some owners add a small amount of unflavored Pedialyte to the water. That's fine in the short term. It replaces electrolytes. but don't force it. Just make it available. Now, here's where most people think the job is done. Dog fasted, dog drank water, diarrhea slowed down. Great, back to the regular kibble. And that's exactly the mistake that brings them into my clinic 2 days later. Because what you feed after the fast matters more than the fast itself. Get this next part wrong and you're right back to square one. Or worse. The bland diet that actually works after the fasting window, 12 to 24 hours. You reintroduce food, but not your dog's regular food, not yet. You start with a bland, easily digestible diet. And I'm going to be very specific here because the internet is full of variations that sound right but miss the mark. The gold standard bland diet for a dog recovering from diarrhea is boiled boneless, skinless chicken breast mixed with plain white rice. That's it. 2 ingredients. The ratio matters. You want roughly 1 part chicken to 2 or 3 parts rice by volume. More rice than meat. The rice is doing the heavy lifting here. It's highly digestible, it's binding, and it gives the gut an easy source of energy without demanding much work from an irritated intestinal lining. The chicken provides lean protein. Boil the chicken thoroughly. Don't fry it. Don't bake it with oil. Don't season it. Boil it in plain water, shred it up, mix it with the cooked white rice. I know, brown rice is healthier, not here. Brown rice has more fiber, and right now, fiber is not your friend. Your dog's gut needs simple, gentle, boring food. White rice, plain chicken. If your dog can't do chicken, maybe there's a known allergy, you can substitute lean ground turkey, boiled the same way with the fat drained off. Some vets also suggest boiled lean ground beef, but turkey and chicken are leaner and gentler on the gut, so I reach for those first. Now, some people ask about cottage cheese, boiled hamburger, scrambled eggs. These can work, but they introduce more fat, and fat is harder to digest when the gut is inflamed. Keep it simple, chicken and rice. Don't overthink it. Feed small amounts. Instead of 2 big meals, break it into 4 to 6 small meals throughout the day. Think of it like this, you're giving the gut tiny, manageable jobs instead of one overwhelming task. A few tablespoons at a time for a small dog. Maybe half a cup for a medium dog, a cup for a large dog, spread across the day. Watch the stool. If it starts firming up, you're on the right track. If it stays liquid after 24 hours on the bland diet, that's a signal we need to reassess. You stay on the bland diet for 2 to 3 days after the stool firms up, not 2 to 3 days total. 2 to 3 days after you see solid poop again. Then, and only then, do you transition back to regular food, and you do that gradually. Mix a little regular food into the bland diet, increasing the proportion over 5 to 7 days. Slow transition. The gut needs time to readjust to the fats, fibers, and proteins in commercial food. Mira, this works. It really does. For most healthy adult dogs with uncomplicated diarrhea, this protocol, fast, bland diet, slow transition, resolves things within 3 to 5 days. But there's a piece I haven't told you yet that makes the difference between it worked and it didn't come back. And that piece is what's happening with the bacteria inside your dog's gut. The gut bacteria piece. Here's something most owners don't think about. Your dog's intestines are home to billions of bacteria, a whole ecosystem. When diarrhea hits, that ecosystem gets disrupted. The helpful bacteria get flushed out along with everything else. And if you don't help rebuild that population, the gut stays vulnerable. That's why some dogs seem to recover, then relapse a week later. The surface symptoms went away, but the microbial environment never fully recovered. This is where probiotics come in. And I want to be clear, I'm not talking about the trendy supplements you see all over Instagram. I'm talking about veterinary-specific probiotics that have actually been studied in dogs. The strain that has the most research behind it in canine GI health is called Enterococcus faecium, specifically a product called Fortiflora, made by Purina. It's a probiotic powder you sprinkle on food. Most veterinary clinics carry it. It's not expensive, and there's real evidence it helps shorten the duration of diarrhea episodes and supports recovery of the gut microbiome in dogs. You can start the probiotic during the bland diet phase. Sprinkle it right on the chicken and rice. Continue it for a few weeks after the episode resolves. It's safe, it's well tolerated, and in my experience, it makes a noticeable difference in how quickly and how completely a dog bounces back. Can you use plain pumpkin? Yes. And I want to be specific. Plain canned pumpkin, not pumpkin pie filling, pure pumpkin. It's a source of soluble fiber, which absorbs excess water in the intestine and can help firm up stools. A tablespoon for a small dog, 2 to 3 tablespoons for a larger dog, mixed into the bland diet. It's not a miracle cure, but it's a gentle, safe addition. Just don't overdo it. Too much fiber when the gut is inflamed can backfire. What I would not give: Pepto-Bismol or Imodium without your vet's direct guidance. I know these are all over the internet as home remedies for dog diarrhea. Bismuth subsalicylate, that's the active ingredient in Pepto-Bismol, contains salicylates, which are related to aspirin. In some dogs, especially those on certain medications like steroids or NSAIDs, this can cause serious problems, including GI ulcers. And Imodium, loperamide, slows gut motility, which sounds like what you want. But if the diarrhea is caused by a toxin or a bacterial infection, you actually need that stuff to move through, not sit there. Slowing the gut down can trap the problem inside. Some herding breeds, collies, Australian shepherds, shelties, and related breeds carry a genetic mutation called MDR1 that makes loperamide potentially lethal for them. It can cross the blood-brain barrier and cause severe neurological symptoms. So no, I do not casually recommend Imodium for dogs. If your vet says it's appropriate for your specific dog, fine. But don't reach for it on your own. That covers the home protocol. But everything we just went through, the fasting, the bland diet, the probiotics, the pumpkin, all of it is only safe and effective if your dog's diarrhea is the uncomplicated kind. And that brings us to the part of this video that might matter most, the red flags you cannot ignore. This is the safety check I promised you. I need you to look at your dog right now and honestly assess what you're seeing. Because there are specific signs that tell you this is not a home care situation. This is a get to the vet situation, and delay can cost you. Blood in the stool. If you see red blood, frank blood, or if the stool is black and tarry looking, that's digested blood from higher up in the GI tract. Either one means something more than a simple upset stomach is going on. Could be hemorrhagic gastroenteritis, an ulcer, a foreign body, or something else that needs professional assessment. Don't wait. Vomiting and diarrhea together. Diarrhea alone in an otherwise bright, alert dog, often manageable at home. Diarrhea plus repeated vomiting, that combination accelerates dehydration dangerously fast. Your dog is losing fluid from both ends and can't keep anything down. That needs veterinary support. Often IV fluids. Lethargy. If your dog is not just a little quiet but genuinely unresponsive, won't get up, doesn't greet you, has no interest in anything, that's a sick dog, not a dog with a tummy ache. Signs of dehydration. Dry, tacky gums instead of wet and slippery. If you gently pinch the skin on the back of your dog's neck and it doesn't snap back quickly, it stays tented. That's dehydration. Sunken eyes. These are urgent signs. Diarrhea lasting more than 48 hours despite the bland diet protocol. If you've done everything right and it's still liquid after 2 full days, something else is driving it and your dog needs diagnostics. Blood work, fecal testing, possibly imaging. Your dog is a puppy, a senior, or has a pre-existing health condition like diabetes, kidney disease, Addison's disease, or is on immunosuppressive medications. These dogs don't have the same resilience to ride out a GI episode. Their margin of safety is thinner. Don't gamble. Your dog ate something known to be toxic. Grapes, raisins, xylitol, chocolate, rat poison, medication that isn't theirs. That's an emergency regardless of whether diarrhea has started. If any of those apply, close this video and call your vet. Or if it's after hours, go to an emergency clinic. I'd rather you spend the money on a visit that turns out to be just an upset stomach than save money and miss something serious. Tranquilo. I'm not trying to scare you. Most diarrhea in dogs is not an emergency. But part of my job is making sure you know where the line is, preventing the next episode. Let's talk about keeping this from happening again, because the best treatment for diarrhea is not needing treatment at all. Food transitions, always gradual. When you switch foods, mix the new food with the old over 7 to 10 days, slowly increasing the new and decreasing the old. Sudden switches are one of the most common causes of diarrhea I see. Secure your garbage. I can't tell you how many diarrhea cases in my clinic trace back to a knocked over trash can. Get a can with a locking lid or keep it behind a closed door. Simple fix, big payoff. Be careful with treats and table scraps. Fatty foods, bacon grease, turkey skin, butter, are murder on a dog's pancreas and gut. A little lean meat is fine for most dogs. A pile of Thanksgiving leftovers is a recipe for pancreatitis, which is a whole different level of misery. Keep up with parasite prevention. Intestinal parasites, roundworms, hookworms, whipworms, Giardia, coccidia, are a real and common cause of chronic or recurring diarrhea, especially in dogs that go to dog parks, daycares, or spend time in areas where other dogs eliminate. Regular fecal exams and year-round deworming as recommended by your vet make a big difference. Manage stress when you can. If your dog gets diarrhea every time you board them or every time there's a thunderstorm, that's stress colitis. It's real, it's physiological, and it's worth discussing with your vet. There are strategies, both behavioral and medical, that can help, and finally, keep a probiotic on hand. Having Fortiflora or a similar veterinary probiotic in your cabinet means you can start supporting the gut microbiome at the first sign of loose stool before things escalate. Think of it as your first aid kit for your dog's gut. Alright, let me put this together for you one more time. Clean and simple. Sudden diarrhea in a healthy adult dog with no red flags. Short fast, bland diet of chicken and rice and small frequent meals. Add a probiotic, add a little plain pumpkin if you want. Transition back to regular food slowly over a week and watch for the warning signs that tell you it's time to stop managing at home and get professional help. That's the vet-approved home fix, not a gimmick, not a shortcut. Just sound, boring, reliable medicine that works. If your dog's dealt with stomach issues before, there's a video right here that goes deeper into the long-term gut health side of things. The stuff that keeps this from becoming a pattern.